Is there really a vaccine available for the coronavirus? Well, Inovia Pharmaceutical Company in San Diego has announced that they have created a DNA-based vaccine to fight the coronavirus. This is a DNA type-based vaccine that uses the blueprint structure. Once injected to the host, the DNA multiplies and teaches the body how to build a defense, as well as how to attack the virus in the form of T cells and antibodies. Inovio Pharmaceutical Company is also behind in producing the vaccines for Zika, Ebola, and MERS-CoV vaccine. The pharmaceutical company in San Diego was invited by the international body based in Europe to partake in the race to create a vaccine against the coronavirus. With the collective data gathered, Inovio was able to make a promising progress out of it. Also, after the Chinese scientist has released the virus's sequences information, the Inovio Pharmaceutical Company was able to create a vaccine within 3 hours after. Which is really promising, given the urgency of the situation with the spread of the virus, reaching 100 countries and affecting thousands of people worldwide. Is the vaccine safe for humans? Unfortunately, it is too early to tell, as the results that Inovio has released are all based on pre-clinical trials, which were tested and done on mice and guinea pigs, which provided positive results. Given the urgency, they will start doing human trials once they have completed the requirements needed for it. If everything goes well with the human trials, Inovio said that they are hoping that they could have it ready by the summertime. But, realistically speaking, vaccines normally undergo a very extensive clinical trials that takes time before they are deemed safe enough to be given to the masses. It may take more time before these vaccines will be readily available in the market. With that said, we should continue with the precautions needed to limit the spread of the coronavirus. The first thing you should know to fight this virus is to know what is coronavirus. Coronavirus is a newly highly contagious respiratory virus that can lead to a severe illness and pneumonia in more vulnerable people, mainly the old, the young, and already sick or immunocompromised people. But, did you know that the common flu is considered to be more fatal as compared to the coronavirus? WHO said that the current and most likely hypothesis is that an intermediary host animal has played a role in transmission, wherein they are suspecting it came from the bats. However, the route of transmission to humans at the start of this event remains unclear. Bats are rarely sold in legal markets in China, but they are hunted and sold directly to restaurants for food. If you have been exposed to the coronavirus or COVID-19, symptoms may show 2 to 14 days afterwards. And what are the symptoms of COVID-19 or coronavirus? Number 1, fever. Number 2, cough. And number 3, shortness of breath. These 3 are the most common symptoms for the coronavirus. Only 5% among all those who were positive for the coronavirus showed symptoms of sore throat and runny nose. If you have developed these symptoms and have been in close contact with a person known to have COVID-19, or you have been recently traveled from an area with widespread or ongoing community spread of COVID-19, which are, per CDC updated last February 28, 2020, are China, Iran, Italy, Japan, and Korea. If yes, please call your doctor, as protocols for isolation management differs from one place to the other. Your local doctors are well notified and updated on the proper procedures for this current scenario and may guide you more appropriately. How does coronavirus spread? The transmission of the virus is mainly through an infected person's saliva. That is why we practice the droplet precautionary measures for the COVID-19 virus. When an infected person sneezes, coughs, spits, or talks to a person with his saliva splattering or kisses someone, the virus can now be transmitted to the healthy person if those saliva will reach the other person. It's either the virus will enter directly through his nose, mouth, and eyes, or it can also go through indirectly. Another way of indirect contact is by touching objects or surfaces that are infected with the virus. Then, this can be introduced to your body by touching your face, mouth, nose, and eyes. Same principle applies with handshaking, so make sure to clean or wash your hands after doing so. Now we already know how the virus is being spread. How do we prevent from having the coronavirus? Like I said earlier, the main way of spreading the virus is through an infected person's saliva. So the best way to prevent it from entering our systems are the following. Number 1, do hand washing often. And please, do it properly with soap and water. At least 20 seconds rubbing the soap in your hands before rinsing it out. You can sing the happy birthday song 2 times while rubbing your hands with soap to mimic the 20-second time. Then only rinse after you finish singing the song. You can also use hand sanitizer or rubbing alcohol. If you feel like your hands are dirty or you feel that you have touched or have been exposed to the virus or any germs, then you can use those things. And for the hand sanitizer, they should at least contain 60 to 70% of alcohol content to be more effective. Number 3, avoid contact with sick people, especially those with the flu or pneumonia-like symptoms. It is hard to tell whether a person has the coronavirus. This is also the reason why some would prevent other people from attending crowd gatherings, events, and big parties, as you can never know if one of those people, has already contracted the virus. Remember, prevention is better than cure. Number 4, if you are sick, stay home. For those with the similar symptoms, please self-quarantine yourself to avoid infecting other people, especially if you have traveled to other countries that are known to have the high number of cases of COVID-19. If the symptom worsens and need further management or medical attention, then coordinate with your local hospital to get further instructions. If you are sick with a different cause, like cancer, or you're on a steroid treatment or anti-rejection medications, or other major illnesses, I highly suggest to stay home as well, unless really needed to, as you might be more susceptible to having the disease. There are few things we can do to limit the spread of the virus by having some basic precautions. When sneezing or coughing, please cover up to prevent your droplets from flying all over. Preferably, please use a tissue instead of a handkerchief. That way, you can just throw the dirty tissue right away in a closed bin. Emphasis on the word close. As with the handkerchiefs, you tend to store them in your pocket or bag after you sneeze or use it, and they can be a source of infections, carriers that may spread to your other items. If you did not bring any tissue or handkerchief, please cover up by using your arm, elbow, or bicep area. This method produces more cover as compared to using the traditional method of using our bare hands, which has some small gaps between or mainly between your fingers. WHO recommends using the arm method instead. After sneezing, please wash your hands if possible. If not, you can use a hand sanitizer. But hand washing is more recommended. Remember, use with soap and wash for 20 seconds, then rinse afterwards. Next is the common term used in media televisions nowadays, which is social distancing. With this, they are recommending at least 1 meter apart from each other, especially in public places. This will limit the chances of transmission to other people. This should be practiced in every scenario, especially in public places. Example, 1 seat apart in public buses, train, and airplanes. This is also applicable in some special gatherings that are really needed for now. Most of the places all over the world now are implementing lockdowns. So please stay in your homes unless you really need to go out of the house. If you feel that you are vulnerable to contracting the virus due to your present illness or condition, please ask someone to buy your necessities in your behalf. Preferably someone young and definitely healthy, as studies have shown that they have a better survival rate if exposed to the coronavirus as compared to the older generations. Again, emphasis only if you need to get some supplies. Because I'm sure at one point, during the lockdown period, you might need to replenish your necessities, groceries, and other stocks. If ever you send that person to buy your groceries, make sure that person is prepared physically, with all the basic protective gears needed, like the basic face mask and at least a sanitizer. As well as he should be mentally prepared, mainly on the isolation protocols to prevent him from contracting the COVID-19. Always bring your hand sanitizers with you, especially when you're in public, wherein you are required to grab public items like doorknobs, toilet seats, grab bars, push carts, faucets, money, telephones, and a lot more things. Just remember, just right after you touch these things, use your hand sanitizer or do hand washing to kill any germs. In order to prevent this from reaching your face, just in case it was held by an infected person with the infected saliva. In order to win against the coronavirus or COVID-19, we should all do our part in helping the government. Prevention or preventive measures is the main key in controlling this disease, followed by early detection and early quarantine. So please, let's help each other to fight this disease. WHO has raised the alert level of the coronavirus to a pandemic stage, meaning the virus has spread throughout the globe. We are in the dark times against this disease. But fear not. History has proven that we have always succeeded in finding remedy against certain diseases in the past. I am hoping that the vaccines that are undergoing clinical trials will soon bring light to these dark moments. This is Nurse Juan de la Cruz. May God bless you and your family with the protection needed against the coronavirus. Thank you for watching.